Mm-hmm.
Good morning, guys.
Good morning.
Morning.
Good morning.
My dear, how was your weekend?
Good.
Good.
Short.
Okay, guys. Now before we kickstart and try to finish this chapter here, it took longer than I had predicted. Any questions?
I have two quick questions.
Go ahead, yeah.
The first one, when I was working on the exercise in the back of the book, I was curious for for example, like thrombosis. Anytime there's osis in a word, it's just going to mean abnormal condition, or is there a time when the O is going to be a connecting vowel?
Well, you had to look at, okay, what you want to call it, what the whole word will end up meaning. Okay. Okay. So it's so that's there's like no golden rule. You just have to say, okay, this is a condition which is not normal. Okay. Well, otherwise, okay, the word cis could also okay mean process. Okay.
Okay. And then I was just curious for like the midterm and final, is it gonna include like things for medical terminology as well, or is it just gonna be
Yes.
A and P focused?
No, it will be medical terminology as well.
Okay. That's all I have. Thank you.
Bless you.
Thank you. Okay, guys. Anybody else? No. Okay. Then let's continue. And guys, what we're going to start off with today is going to be as okay. Prefixes. Okay. Now, if you just look at the word prefix itself, yes, okay, gives us yes, okay, the meaning of it, because the word pre actually yes, okay means sorry before. Did you guys get that? Okay. So the word pre itself means before. Okay, and before what? Yes, okay. The root word. So if we have a root word here, anything that okay comes before the root word is going to be a prefix. Did that make sense? Okay, so far we have talked about root words. We have talked about suffixes. So today we're going to talk a bit about the prefixes. Okay, which means going to be as okay what comes before the root word. Okay. Anybody have any question about that? So our first prefix is going to be a or an. Now both of these as okay here will mean the same thing, which is going to be no. We can say as okay non. We can even say as okay absence of. Yeah, okay. Now the question is just going to be is okay, why two prefixes that mean the same where one is a and one is and? And when do you use a, when do we use and? Now, guys, we will use the word a as a prefix, which will mean this. If your root word begins with a consonant, whereas we will use and as the prefix, which will mean yes, okay, no, none, or the absence of. It's okay if the root word begins with a vowel. Did you guys get that?
So we use a or an if the root word starts with a
Now,
vowel.
if your root word starts with a consonant, you put a in front of it. Okay?
Can you give
Where
us
if your root word starts with a vowel, you add the prefix an, or what the prefix is going to mean. Okay? Or there's the same rule as you say, it's okay. In English, yes, okay. Primary, okay. You say a boat. Okay? You may say a goat, right? Okay? You may say a coat. Now, all these words, yes, okay. What do they start with? They start with a consonant, right? Yeah, okay. But here is okay, what a boat, a goat, a coat will mean that okay, yes, there's one boat, there's one coat, and there's one goat. Clear? Okay. Here, the prefix is going to become a part of the word. Clear? Okay. Okay. But that's mainly that's okay where the root is okay. You can say the root. Where okay, on the other hand, you can say it's okay. You may say an elephant. Okay, you can say an umbrella. Okay, so it's the same rule, mainly because okay, your root word starts with a vowel. Okay, that you use the word and in front of it. Okay, but of course that's okay, it will still mean it's okay, an elephant and an umbrella. Okay, so that the same rule applies here, but it's okay, what is that the prefix a or an is going to mean is no, none, or absence of. Did that make sense to you? Okay, so did you get that? Okay, but here it's okay, it's not going to be a number of count. The a or the n mainly that's what will mean. The absence of or not present or yes, okay, none. None of what? Whatever your root word is going to be. Okay, but whether you use a or n is all dependent upon whether your root word starts with a consonant or a vowel. If it starts with a consonant, you use a. If you starts with a vowel, you use n.
So example like anemia.
Pamela?
So an example would be like anemia.
Yeah.
Anemia.
Okay. Anemia or anemic or whatsoever. Okay. Okay. And we can make this okay. Okay, let's see. Okay. So guy, you have to know yes, okay, your vowels to begin with. Okay, now anything. Now we can just say that's okay, a couple of examples with E. You can say E pass, and I'm just going to it's okay, right like this. Although it's okay, will become pass here would be a one word, but here it's okay. E, what does that indicate? That this is a condition. in which there is no. And fast here is okay, mainly means speech. So in case of loss of speech, that will be referred to as aphasia. Did that make sense? Right, okay. So a state in which as okay, the patient have no speech or have loss of speech is going to be referred to as aphasia. But why did we use A here? Mainly because, okay, your ruled word started with a consonant. Yeah, okay. We can take another one. We can say A, which I think is okay, what does mean? No, or the absence of. Now we just take our rule word here, which is going to be nia. Okay? Okay. Which is going to be nia. Okay. Now, what does the word? Now, literally, guys, okay, what the word nia actually meant is ear. Okay. But here's okay here. It is going to just okay be referred to reading. Okay. So it's going to be a nia. Not really, because here it's okay, the P is not silent, so it's actually going to be pronounced as apnea. Yeah, okay. It's going to be pronounced as apnea. Okay, but where it's okay, A mainly means no or the absence of breathing. Okay, so that's how it's okay, your word apnea is produced. Okay, some of you may have heard of, okay, as an example, like sleep apnea. Okay, where the patient mainly is okay, will stop breathing for okay as a longer or shorter period of time while being asleep. Did you guys get that? We can take another one. A. And okay, yes, we can just say E. Okay, back in, yes, okay, here, yes, okay, this becomes the name of a condition because it ends with E. E. In this case, again, yes, okay, or mean no. Or no, yes, okay, the absence of kinase. Okay, where the word kinase means, yes, okay, is movement or motion. Okay, so if a patient, for instance, okay, isn't moving, that state would be referred to as akinesia, or he or she may be akinesic. That's like, okay, a patient who suffers from aphasia will be aphasic. Did that make sense? Okay, and again, yes, okay. Why do we use A here? Mainly because, okay, the rule word that we used began with a consonant. Just like here, it's okay, the rule word that we use, P is a consonant. Did you guys get that? Yes, guys, any questions? No questions? So is it clear so far? Good. Let's go on and see. Okay, we have some fellows that start with. Or we can use en. Now that is what we call and. We can say it's okay. M and ia. Yeah, okay. Now what the ia here is okay will become is okay that this is a condition. M is okay blood. So emia together, guys. Made is okay will become is okay. Or we can call it okay a blood condition. Now when you see a word ending with emia, it's going to be a condition is okay related to blood. Okay. But here is okay, we had the rule word and in front of it, which mean is okay or mean no or none. Okay, now that doesn't mean that okay, there's no blood condition. Okay, what we now know as anemia is okay, literally meant a condition in which the patient has no blood. Okay, that's going to be as okay, very extreme. Now back in the days, and they mainly as okay referred to as okay having no blood because the patient will look pretty pale. Well, they still will look pale if they are anemic. Okay, but the main says okay, he looks like he or she doesn't have any blood. That was a little bit extreme because if that was the case, that's okay, the patient would have been dead. Did that make sense? So now as okay, we may as okay just define anemia as okay as a low count of either red blood cells or low levels of iron in the blood. Okay, but why did we use N here and not A? Mainly because your ruled word, which was M or emia, started with a vowel. Did you guys get that? We can take another one. And okay, Orex. Yeah. So it's okay. This whole word here is okay becomes the name of a condition because we said because it's okay. It ends with ia. Now, what the word orex actually means is not okay. But mainly it's okay. Appetite. And what is an? No or none. Or here because it's okay, loss of. Clear, okay. So okay. Now what do we use and here instead of a? Because you can still say it's okay that your ruled word, which is orex, starts with a vowel. Okay. So anorexia means as okay, will be as okay, whatever was okay, loss of appetite. I have no appetite. Now the term anorexia is a little bit more, yes, okay, you can say complex than that. Okay, but when you say anorexia, yes, okay, that becomes the condition, whereas if you said anorexic, that just becomes, yes, okay, pertaining to anorexia. So that most likely, yes, okay, be the person that you're talking about. He or she is anorexic because he or she may be suffering from anorexia. Did you guys get that? Right. So whether we use a or whether we use an, they both mean the same. The absence of or lacking of or no or none of whatever your root word is. Any questions? Yes, guys. Okay. And please, 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 the way that this is pronounced is apnea. Okay. Okay, guys. Otherwise, in many other instances, okay, you may see that, okay, as the P here is okay, is going to be written, but it's going to be silent. Did that make sense? So it's not going to be ania, it's going to be apnea in this instance here. Did you guys get that? Okay. Okay. Now a word which is not really written in your book at this point here, but okay, yes. I still just want you, it's okay, bring it on. Anti. Now what the word anti would mean is against. Okay. Now we can take an example of, for instance, anti biotics. Where here's okay, bio means life or living. Tick is okay as pertaining to, and anti is against. Okay. Now, although it's okay, literally it's okay, the word mean that's okay, anything which is against living or like living organisms or life. Okay, but please keep in mind nowadays it's okay, the word antibiotic is going to be as okay used for a group of drugs used to treat bacterial infections. Okay. Now another word. Now you may not see it like this, you may actually see it as and like this. Antacid. Where the word acid here means it's okay, just acid. Okay, it should be more specific. It's okay. The mean is okay. We'll talk about things like stomach acid. Where the word and here it doesn't mean it's okay, that little crawling fellow. Where it's okay, where the mean is okay, just because it's okay, eliminated or took out the I. Okay, what it actually is a graphene anti-acid. Okay, but it's okay. They just took out the I, so it becomes antacid. Okay, so mean again, it's okay, just a drug to treat is okay, what we call heartburn. Okay, meaning because okay, that heartburn mainly is just okay, primarily due to stomach acids. Okay, now two antis guys that I want you guys to be on top upon. There's something that we call an anti-gen. Or actually it's okay, it becomes pronounced as antigen. Is that clear? Now, antigen, guys, is okay as a very broad term. Okay, but what remaining as is okay, then an antigen mean is going to be as okay a substance that is okay. We can say it's okay either as okay enters the body. An example of an antigen could be something like okay, yes, what we call a pathogen. Okay, which we mean as okay, commonly as okay, we'll just know as a germ. Okay, there are going to be other kind of SOK gens or antigens, which could be SOK, or we can call an allergen. Okay, and what these mean is okay will lead to is allergy. It's in the word. Allergy is okay, meaning from this. Gen, that's okay, producing it. Okay, and of course, that's okay, guys. There are going to be okay some antigens that is okay we are born with. Okay, so some antigens is okay we pretty much okay as inherited by birth. Did you guys get that? So as far as okay,
Sorry, I just had a question.
yo,
So what is like the meaning of gen?
gen to produce.
Okay,
What
Thank
the
you.
word gen actually means is to produce or create.
thanks.
I have a question.
Yo,
So the examples that you're using that you said are not in the book, are those going to be on the quiz as well, or are those just examples?
no, I would recommend that they could be on the test.
So know it just in case.
Yeah.
Okay, thank you.
Okay, and it's going to be helpful, yes, okay, in the future. Did you get that, Dicky? Now, guys, the other thing when we use the word anti is going to be when we say anti body. Now, what an antibody is going to be, it's going again, it's okay, it's going to be it's okay a substance that the body produces in response to the antigen. So have any of you wondered, yes, okay, what happens when you get sick? The other day we talked of strep throat, right? Clear, okay. Why do you get a strep throat? Because, okay, that streptococcus bacteria enters your body. So that streptococcus bacteria, that is a pathogen, or generally, as okay, saying it's going to be a germ. Clear? Okay, so in this case, yes, okay, he or she is going to be the pathogen, or we can just say as okay, antigen. Now, what was it that your body was going to do in response to that? Produce antibodies. Did that make sense? And guys, it's when there's this pretty much okay direct warfare between the two. Okay, that okay, as you may start feeling not on the top. Okay, all that fever and all that. That's mainly because okay, there's a war between the antigen and antibody. Okay. Or you can say another way, I guess, okay, allergy season is coming up. So if anybody is okay, suffer from bad allergies, it's okay. Here's what happens. That pollen in the ear. A lot of people may be as okay, super allergic to that, right? Okay. It looks nice to look at the flowers and the blossoms and this and that, but it's okay, all that pollen. That's going to be an allergen. Now you inhale that, unless okay, you're wearing okay as a super filtering mask, but that's probably not comfortable either. That pollen, antigen, or it's okay, in this case, it's okay, allergen enters your body, your nose and your airways and all that. And mainly because the body recognizes, okay, this is not something which is normal. Anybody will produce antibody, but the difference between is okay, anybody versus somebody who is allergic is that they mainly is okay, just overreact. Their body overreact. And now produces antibodies against that pollen or dust or whatsoever. And that's when there's this clash between these two. That okay, some people may have okay severe allergic reactions. Okay, so pretty much okay, as anything that happens is, and that in those kind of states is a reaction between the antigen that your body produces in response to the antibody which entered your body. And that's why it's okay, you may, as a second, yeah. That's when you have sneezing. Some people may have okay, some severe rash, etc. Okay, okay. A deadly example of okay, as allergies is what we call as okay, an anaphylactic shock, where the patient's blood pressure pretty much falls down. Okay. All that okay, swelling of the tongue, swelling of the throat, having difficult. All those are as okay due to that severe interaction between the antigen and antibody. Now we are still only as okay in 2024, so that's okay. You guys may recall that okay, as when they were trying to as okay develop vaccines for COVID, they were looking for people who already had suffered from COVID, right? Why? Because they wanted to as okay. And you can say, okay, I suffer from it, and okay, of course, that's okay, I survived. Because what was it that those people had produced in response to yes, okay, COVID? Antibodies. And the structure of those antibodies could yes, okay, provide us with a lot of clues of okay, as what might be effective against the COVID virus. So those people who had suffered from COVID and had survived, yes, okay, they were in high demand. Okay, so in this case, yes, okay, what was it? The virus itself? That was an antigen. And what was it that their body had produced in response to that was the antibodies. Did you guys get that? But please, 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 guys, as I said, okay, there are going to be some antigens that we are born with and some antibodies that we are born with as well. Okay? But besides those, yes, okay, pretty much okay. Anything that you may get exposed to is going to be as okay an antigen. And what your body produces in response to that exposure is going to be an antibody. Yes. Justine, you had a question there?
Oh yeah, but you answered it already. I was going to bring up like for an example, COVID would be the antigen, and then your body produces the antibodies from it.
Exactly. And that's why they were in high demand. Okay. Okay, guys. So please, 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 please make sure that you know the difference between antigen and antibody. Okay. Good. But. Okay, thank you. So antigen is okay, would be a substance that not necessarily enters the body that yes, that you may get exposed to. Okay. Okay. And okay, antibody is a substance that the body produces in response to the antigen. But as I say, it's okay again, it's okay just for just like antigens. Some of them is okay, we are going to be born with. Okay. Likewise, okay, there are going to be some antibodies which we are going to be born with as well. Okay. Where do we get those from? Yes, okay, pretty much from our parents. Now back to the book. Out, which actually that's okay, is derived from the word auto, which means yes, okay, as a whole, yes, okay, will mean self. Just think of the word automatic, right? Something that happens automatically happens by itself, right? Okay. Or you can say as okay, the ability of happening by itself is going to be as okay, okay. Okay, so something that has the ability to happen, or we can say, okay, the ability to happen by itself, or automatically. It's going to be called automaticity. Now, those guys who are CVT, this is a term that you will come across when talking about the heart. Okay, because, okay, one very unique characteristic that the heart has is automaticity. Okay. That generally speaking, yes, okay, it beats on its own. It doesn't take orders from anybody else. Okay, so its ability to be able to beat on its own is what you would call as, okay, automaticity. Did you guys get that? Okay, but if you just look at the word automatic, it pretty much sounds self-determined or self-dependent. We can say auto is again, it's okay, was self immune. Okay, which means it's okay has to deal with, we can say it's okay, protection. Now, autoimmune, guys, as I said, okay, and now for me, it's okay, get as a result of, okay, as an immune action. Is that okay, yes, that will lead to, sorry, the production of antibodies. But it was when those antibodies attack yourself, or you can say, okay, that you're attacked by your own antibodies, that whole phenomenon will be referred to as autoimmune. So pretty much, okay, the antibodies that we made here, okay, mainly because, okay, why were they made? Mainly as, okay, in response to the antigen, mainly to try to protect your body from the antigen. Okay, but, if those antibodies actually is, okay, now go and attack your normal cells, your normal organs, exactly. The outcome of that is going to be, it's okay, what we can call it's okay, autoimmune, or it's okay, what we mean is, okay, we'll just say it's okay, it'll be an autoimmune disease. But it's pretty much, okay, your immune system that attacks, or you're attacked by your own immune system. Did that make any sense? Okay. Any questions? And of course, okay, then we had this, okay, the auto, which has not really much to do with, okay, itself, but we just said, sorry, Opsy, right? Okay. Where the word opsy mean is okay, mean or meant to view. And here it says okay, auto. Okay. Right. Or when we said autopsy, what would that mean? It's okay to view. Or it's okay, examine. A specimen. That's okay. Which was going to be as okay from that person. Did you guys get that? Oh, yeah. And what that meant was complete. Well, okay. The orifice is okay, meet the word. Diagnosis. Okay, where again it's okay, you can say it's not going to be diagnosis, it's going to be pronounced as diagnosis. Okay, but where it's okay, the genosis meant knowledge or to know. Yeah, okay. So I have okay, having a complete knowledge was what we call diagnosis. Now that's mean it's okay, that's going to mean it's okay that we have it's okay, we have a complete knowledge of what is wrong with the patient. Okay, how do we achieve that? Pretty much okay, yes, by taking into okay the patient's signs and symptoms. Okay, a clinical exam. And okay, as if something is needed, yes, okay, we will just call those diagnostic procedures. CAT scans, MRIs, X-rays, ultrasound, urine tests, swab throat, all that. Okay, those are diagnostic tests or diagnostic procedures. Okay, where the word diagnostic would just be pertaining to diagnosis. Okay, clear? Now, guys, you can check another word. You can say dia Rhea. Now, nowadays, it's okay when we talk of diarrhea, it's okay. What I mean is, loose motion, right? Okay. A watery poop. But if you look at the word diarrhea here, it's okay. What does that mean? Di would be complete. And rhea actually is okay, means discharge. So I guess, okay, they came up with this word here. Or it's okay, what you call loose motions, mainly because if you have had, okay, loose motions for quite a few days, 4, 5, or 10 times a day, once you make it to the doctor, it's okay, you're completely wasted. So based on that, it's okay, they mean it's okay, okay, you look like you are completely, it's okay, whatever fluid you had is completely discharged. Okay. Where we can also say, it's okay, the urea, discharge of, okay, yes, fluid. So that's okay. You remember that osmotic rain, right? Okay. Oh, you forgot that one. Rhinorrhea.
Is that a runny nose?
Runny nose, right? Okay. Okay. Or discharge. It's not that your nose physically is taking off. Right, okay. But it's just running. Okay. And what is running is okay, probably is okay. Whatsoever the color of that is going to, it's okay. It's going to be a discharge. Uh, There are what we call as okay dialysis. Yeah, okay. Okay, as here it is. Shit. It's going to be as okay. A complete in the cis analysis, okay, this just becomes okay that we're talking about a procedure or process where the lie yes, okay, come from lies, which means breakdown. Okay, so a complete breakdown or a process of complete breakdown. Okay, now usually it's okay, a word that we mean is okay, use related to yes, okay, patients for kidney failure. Okay, now all this okay, it's going to be in a later chapter, but that's going to be as okay. We actually is okay, we'll call it peritoneal dialysis. Okay, peritoneal dialysis. But that's made as okay, peritoneal made okay, just the way that okay, as it is being performed. Well, let me see.
Sorry. Oh, what was the word peritoneal? What did that mean again?
Okay, don't worry about that. We talk about peritoneal in the next chapter, my dear.
Okay.
Okay. But that's okay here. The EAL is going to be as okay pertaining to periton, as okay mainly from the word what we'll call the peritoneum. Now, one of the blue is the peritoneum. We will talk more about that in the next chapter. Okay, but usually it's okay. Dialysis isn't going to be as okay written alone, but actually going to be as okay peritoneal dialysis. Okay, guys. Now, one of my favorite ones is this. Now, here's okay. The word "this" here can mean different things. It can mean bad. It can also, it's okay, be used to in context of painful. And it also can be used in the terms of difficulty of. Bad, what, painful, what, difficulty of what? That's okay. Whatever your rude word talks about. Okay. Now let's just take a couple of examples. Now, guys, there's going to be a word that's going to be this. Now, please keep in mind here, okay, the word "this" is going to be pronounced as "this," and which means that's okay, or mainly that's okay in this context, there being difficulty of. Now, here's okay, although the word is spelled P-N-E-A, where the word P-N-E-A actually meant ear, but here it's okay, is going to be taken in the context of breathing. So what this P-N-E-A, okay, just give me a sec, guys. Be right back. Okay. So guys, please hear. This is going to be just pronounced as this. Yeah, the P is written, but it is silent. Did you guys get that? So what is that Disney is going to mean is going to be difficulty in reading. Did you guys get that? Okay. So Disney is going to be difficulty in breathing. And as we said earlier today, we had something that we called apnea, where there was going to be as okay, no breathing. Did you guys get the difference between the two? So dyspnea, if you have difficulty in breathing, apnea is if you don't breathe. If somebody stops breathing, he or she has apnea. There's no breathing. Okay, whereas okay, yes, you are still breathing, yes, okay, although yes, okay, you may have dyspnea. It's just going to be harder to breathe. People reference yes, okay, an asthmatic attack. What freaks them out the most is that they have difficulty in breathing. Okay, okay. So that will be dyspnea. Clear? Okay. Another thing is that okay, guys, the way that they are pronounced. Because okay, here in apnea, it was AP and then nia. As okay, when we say dyspnea, it's going to be this. The P is silent, and then nia. Did you guys get that? We can take another one. We can say it's okay, this. Okay. Dysphagia. Now what this here is going to mean is, again, bad. Aphasia is going to be as okay, fast for speech. And here is okay, just indicate okay, this whole word here is okay, becomes a condition. Okay, now please, guys, this doesn't mean to have a bad speech or rather say being foul-mouthed. That's not what dyspnea means, or dysphagia. Dysphagia just means that the patient or the person has a difficulty in speaking. Okay? So dysphagia is going to be as okay, difficulty of speaking. Whereas on the other hand, we said earlier this morning, what did we say? Aphasia, which means it's okay, or mean that okay, that there was that the patient had no speech, not speaking at all. Did you guys get that? So in both cases, okay, you guys says okay, difficulty or no, bad or no. We can take another example. We can say this. And here's okay, the word this can mean either. Okay. It can mean as okay, difficulty in or difficulty of. And one of the reasons that it's going to be as okay, be difficult to is mainly is okay because it's going to be painful, which will be this urea. Well, let me just write that. Okay. Now here again, guys, okay, the term ia means okay indicate that this is a condition related to ure is going to be as okay from the word urine. Okay. So for instance, okay, either if the patient has, I guess it's okay, difficulty of peeing, or whether it's going to be as okay, painful or pain This is okay, painful while. Yes, okay, peeing. Both of them can be referred to as dysuria. When we look at the term urea together, it means okay, this becomes just okay, we can say a condition of the urine. Okay, where the ear indicate that it becomes a condition and you're related to your urine. Did you guys get that? Okay, so a common symptom of, yes, okay, what you can call is okay, a UTI is going to be dysuria. Okay, in that case, okay, it's mainly going to be as okay, painful while peeing, or as we say, it's okay, may say it's okay, letting the water go. Good. We can take another one. Anybody? Do you guys mind if I go to the next slide? Okay. Now just here, guys. Okay, just since we can say all this. Okay, we didn't mention it earlier, but we can say it's okay. That would be a term which we can call as okay, and urea. Again, it's okay. The word "e" just becomes just okay, a condition. The urea is okay, yes, the PP or urine. And when we say it and, no or none. Okay. So pretty much okay as when the patient does not produce any urine. That thing is going to be as okay referred to as anuria. Okay. Now, clinically speaking, guys, if you pee or produce less than 500 cc's of urine in 24 hours, you clinically as okay are suffering from what you call anuria. Okay. 500 cc's or 16 ounces. Those water bottles, if you're not able to fill those up in 24 hours, that's anuria. Okay, now don't go and start peeing in. Okay, in water bottles, I'm not okay. But it's okay. You can see it's okay. The difference between and this. Clear? Okay. Okay. Let's take another one. So we can say it's okay. This. Here it's okay. I'll be using okay. Dysmenorrhea. For me, it's okay. Let's say it's okay. That the word rhea mainly is okay meant. We can say it's okay. Flow or discharge. Here it's okay. The word this most likely is okay or mean. I'll be referring to painful. And this men here has nothing to do with the male sex, rather vice versa. I mean, it's okay, come from menstruation. So pretty much, okay, as if somebody is, okay, complain of pain while menstruating. Okay, that's how it's, okay, the patient may present. But that pain while menstruation actually is going to be, it's okay, dysmenorrhea. Okay, so dysmenorrhea, guys, are going to be, it's okay, pain while menstruating. Did you guys get that? Now another word. We said the first, yes, okay, may, if you look at it, yes, okay, may practically is okay, mean the same, but it's okay, this is going to be used in a different context. It's going to be this, man, oh. And here we'll say regia.
I'm sorry, is that REHAGIA?
It's RRHAGE. It's double RHAGIA. Okay, where cautious, okay, here is okay, we say ear. Well, okay, yes. This whole word here becomes, okay, the name of a condition. Here the word this doesn't necessarily mean painful, it rather does refer to bad. Or we can say, okay, abnormal. Men is again, yes, okay, going to be as okay, pertaining to menstruation. And the word rash here is bloody. Okay. So maybe say, okay, there's something to do as okay, there's something not normal with the bloody discharge of the menstruation. But guys, when we use the word dysmenorrhagia, this is going to be as okay, where people may what you actually call as okay, heavy menstruation. It's technically going to be known as dysmenorrhagia. There's painful menstruation, or pain is okay during the menstruation is going to be called dysmenorrhea. Okay, all those, okay, when you look at the word dysmenorrhagia, well, okay, this, something which is not right, menstruation, and rhagia is okay, bloody discharge. But it's okay, what is that? It's been discharged during a menstruation. It's okay, a little bigger or smaller amount of blood. Okay. So dysmenorrhea is painful menstruation. Dysmenorrhagia is going to, it's okay, what you would call heavy menstruation. Did you guys get that? Now, what would be, it's okay, if we had no menstruation? What would you call that? Yeah.
Oh. Amenorrhea, amenorrhea, or no?
Exactly. Amenorrhea, right? Okay. So if you just says, okay, displace this with E, it become mano. Here the man doesn't mean men, but it's okay, come from menstruation. And okay, yes, you can say, oh, yes, combine the vowel anyways, and we can say it's okay, Ria. So amenorrhea, right? Okay. No menstrual discharge. Okay. For some people, that may be good news. For some people, it may, okay, bad news. When can amenorrhea happen?
You're pregnant.
You're pregnant. Okay, good. Is that good or bad news?
Depends on the person.
Depends. Yes. Okay, good. What else can be the reason for amenorrhea? You're not pregnant.
You have like a hormonal problem.
Okay, good. Irregularities in your period. Okay, good.
Menopause.
Menopause. Are you as okay premenopause? There's going to be greater and greater periods of amenorrhea. And the 55-year-old lady may freak out thinking, no, she may be pregnant again. Do you guys know who was okay? What the oldest age to be pregnant at? I think somebody mentioned it. Not in a medical discussion, but I read it that okay, it's 67 years old. So yes, okay, grandchildren and children are of same age. They can play together. So, probably not normal. Okay. Likewise, octomom is not normal either. Have anybody ever heard of octomom? Nope. Some of you might have been, yes, okay, too young when she was around.
Yeah, she had like 8 kids.
She had 8 kids, right? Okay, that's where the word octo come from.
Yeah.
Octo is 8. Okay, so octomom had 8 kids.
Yeah, through IVF or the other procedure, not IVF.
Okay, however she achieved that, there was also a lot of paternal issues, right? Okay, because who's going to pay the child support? And okay, peace be with that. But yes, okay, that was not normal either. Good. What else can we have difficulty in our bed in our okay, guys. This and again, it's okay, a word that I will be using again and again and again. Now what the just indicates, yes, okay, that this whole word, yes, okay, became the term for a condition in which the person, well, okay, he is not going to be mad. It's not going, it may mean pain, that's okay, it can be painful, but usually it's okay, we will say it's okay, difficult. Now, what the word fag actually is okay would mean is to swallow. So if people have as okay difficulty swallowing the food, that's how it usually starts. And then it goes on from foods to liquids. That's going to be as okay what you can call dysphagia. Okay, guys, so dysphagia is going to be as okay difficulty in what you can call swallowing. Okay, where we mean is okay, we just change one letter in this case here to S, it becomes just okay difficulty in speaking or difficulty of speech. Clear? Okay. The most common example of or reason why it's okay people may as okay start suffering from dysphagia is cancer of the esophagus, where it becomes more and more difficult for them to swallow the food. It may also be as okay psychological. Yes. One of my best friends, I will say it's okay, my best friend from med school. He ended up having, for a short period of time, having anxiety-induced dysphagia. That okay, he will get these anxiety attacks, and okay, yes, the whole yes, okay, his anxiety attack started by him having difficulty of eating. So nothing physically wrong with him, but he just like okay, felt okay. What if I'm not able to swallow this food? What if I choke on it? It's all those like okay thoughts. And I'm mostly as okay started by getting triggered in okay as in big gatherings. Like it was more than 5, 10 or people around. You say I need to eat alone. Or just one person or 2 person accompany me. So it's okay. For those couple of months, that's okay. There was no going out and eating at a restaurant or so and so with him. So and he couldn't even go down to the dining area in our hostel or boarding house to say, okay, what's on the menu today? Okay, give me a plate of this, a plate of salad, okay, 3, 4 pieces of bread, and okay, yes. So what would I have to do? When it was dinner time or lunchtime, I would go by the dining area, say, okay, this is the menu. Then go to his room and say, okay, listen, dear, this is the menu. What do you want? And it's okay, just order a plate of this and so and so. And I went down, okay, say a plate of this and this for him. And okay, a plate of this and this for me. Send it up to room so and so. So, but yeah. So that's what dysphagia. And okay, our previous okay made him even okay freak out more because okay when he looked it up in the book, the first thing that it mentioned was okay yes, cancer of the esophagus. So that didn't help. Okay, guys. So yes, okay, dysphagia. Good. What else can we say about? Now, guy, yes, okay. Yes, okay. This is difficulty in swallowing. Your book has, okay, has one term when it talks about this, which is going to be, yes, okay, this, and the word is going to be enter, and then we, yes, okay, just ly. Y at the end. Because the y is okay, does this become yes, okay again? It's okay. A process. Here you can say it's okay, the word this is mean it's okay going to be bad. And if you look at the word enter, what did the word enter mean?
Intestine?
Oh, small intestine.
Intent. Clear, okay. Now but as a whole, it's okay what the dysentery is going to be, it's okay, that's just going to be it's okay, because it's okay, a severe form of diarrhea. Okay. Usually it's okay when we say it's okay, what happens in dysentery is that okay, the patient pretty much will have watery stools. Okay, that his or her poop. Okay, that's what you want to call it. Maybe it's okay, it just looks like okay, psst, you open the tap. Flushing out. Yeah, okay. So that's pretty much okay what happens in dysentery. So they may as okay say, okay, something wrong with the gut. Okay. That's how this word came into being. And of course, it's okay after a few episodes of that, it's okay, you pay, it's okay, the patient is completely discharged. Okay, or you can say it's okay, wasted. Okay, guys. I'll just take a short break, and when I see you guys back, it's okay, we will continue. Okay, guys? Any questions yet? Okay, so this can mean it's okay, bad. Why may something be bad? In some cases, okay, because it's painful. Okay. And in some cases, okay, maybe just difficult. But please make sure that, okay, as you know the difference between this and E or N. Okay, where E or N will mean is, okay, complete absence of. Where this would mean difficulty, painful, or so. So there's a hell of a difference between apnea and dyspnea. Okay, there's a hell of a difference between dysmenorrhea and amenorrhea. The person with dysmenorrhea probably wish to get amenorrhea. Okay, and so and so. Good. So I see you guys at, should we say 10:50? Is that a fair deal? Okay, have fun till then. Okay, guys, welcome back. So, any questions? Good. Endo. Within. Now we may have something that we call endocrine. Here's okay, the word endo is just going to be yes, okay. It's within or inside. The word crine, and it's going to be pertaining to secretion. So in all this is okay, there's going to be okay what we may call endocrine glands. Now our glands mainly is okay substances that are structure that produced a secreted a secretion, right? But these glands will be called endocrine mainly because the secretion that they secrete is secreted into the blood. That's why we call the endocrine glands the endocrine glands, because whatever secretion that they secrete is going to be secreted into the blood. Okay, but these secretions here are going to go under the name of what we call hormones. Did that make sense? So the secretion from your endocrine glands are going to be called hormones. But why do we call them endocrine glands? Mainly because they secrete their secretions into the blood. Did that make sense? Well, okay, we can take endo as a word where it actually is okay, more specifically is okay, it means inside. You may come across a word called endothelium. Now, guys, when we end up with meaning yes, okay, this whole thing is okay becomes the name of a structure, which is within, or rather, it's okay, we can say it's okay on the inside. And tally, not really, but we can mean it's okay, just say it's okay. This case it will be it's okay aligning. So guys, usually it's okay in all body structures where you say it's okay that we, for instance, okay, it's a passage. Okay. Now that innermost layer or lining on the inside of that passage. Let's do it this way. Let's say that we take a cross section of a passage. Okay. And the layer that you'll find on the inside of this passage here, that is going to be referred to as the endothelium. Okay, now when we say endothelium, that's okay, that just becomes the name of this layer here. Okay, where we can okay, just change the suffix to L, which just becomes okay, pertaining to this, or pertaining to this inner layer. Or we can say pertaining to the endothelium. Okay. But the reason that we call it endothelium is because it's going to be okay, the layer that lines the inside. Did you guys get that? Yes, guys. The probability. Okay, that's fine. Okay, I can just check you guys off a little bit of terms from the book. Because why there's going to be a term that will be inter. And we can say, okay, inter versus intra. Yeah, okay. Always you mean is okay, we'll say it's okay. In both of these cases, okay, you have the word int or in, which will mean in and in. Okay, guys. Or where the word inter is going to be in between. Perfect. I can spell that better. So did you guys get that? Whereas the word intra is going to be inside. Did you guys get that?
I just had a question. So what would be the difference, did you say, between endo and intra?
Huh? Not
Like the
really. In
different,
some cases, you just use the word inter, and in some
Okay.
cases, you will just use the word endo.
okay. Thanks.
Okay. But here it's okay if you look at it, okay, it's inter and intra. It's okay, they both have something to do with in. But my idea is okay if you, for instance, okay, take any structure. As I do it this way. Now, this is going to be inside the structure. So that will be referred to as intra. Let's just say it's okay. This structure here is okay, for instance, okay, was, let's say it's okay, your liver. So that's going to be as okay, intra hepatic, inside the liver. Did that make sense? Now where you say it's okay, inter. Now when you say it's okay, in between. What do you need for us? Okay, something to be in between. It needs to be in the middle or in between two structures, right? Did that make sense? Guys, don't look so lost. Now, let's put it this way, guys. Look at it. There's a person standing here. And there's a person standing here. Right? Now, if I say to a third person. Go and stand in between them. He or she will end up standing here, right? Well, what was my command? Stand in between them. Did that make sense? And for that, you can use the word inter. Did you guys get that? Whereas, okay, guys, on the other hand, if I say it's okay, intra, then I may have command this person, well, okay, go and either get inside him or her, or get inside him or her. So yes, okay, there's a hell of a difference. Okay. So usually it's okay, when do we use intra? If it's something that's inside. Where you use inter if it's in between. Or have any of you ever thought of the word intermediate? If you just look at the word intermediate. Yes, okay, the word inter is going to be yes, okay, in between, but the word media is also going to be the middle. So where do you say it's okay, intermediate school? Why do you call it an intermediate school? Because it's in between primary and high school, right? Is those couple of years of schooling is okay, where you're out of primary school, but you haven't reached high school yet. So it's in between those two levels, right? You talk of pain. It's an intermediate pain. It's not a low pain, but it's not a strong pain. Okay, so from a scale of 1 to 10, those 4 to 6, 4 to 8, or 5 to 7, or whatever you want to put it as, right? Did that make sense? They don't fall on the low end of the scale, but they don't fall on the high end of the scale. It's in between. So use the word intermediate. At both of these words, that's okay, whether it's inter, it's in between, media, middle. So in between, in the middle, if you want to put it that way. But you can only be in the middle if you're in between two things, right? Did that make sense? Whereas intra is inside. You get a shot or an injection. How do they give it? They can give it intramuscular. Now, if you look at the word intramuscular, what would that mean? That would mean inside the muscle. That's why it hurts. Okay. That's why that hurts. And okay, as you may be suffering from a aching shoulder or whatsoever for a couple of days, myalgia. Clear? Okay. But why do we call it intramuscular? Because that it is, sorry. If we say it's okay, if this is a muscle, it's going to be intramuscular mainly because it's okay, they inject it into the muscle. Clear? Okay. Did that make sense? If you go and you get, okay, that's what they call an IV. Have any of you ever got an IV? Now here's, okay, the I is intra, which means, okay, inside. Venous. Okay, this is becoming, okay, pertaining to, yes, okay, veins. So mainly because, okay, you have a vein running, and they give that inside your vein. That becomes an intravenous. Did you guys get that? Okay. We can take another one. Intra. The chart I recommend here is going to be cranial. No, we can make it's okay, let's use, okay, as a separate word here. Just yes, okay, so you guys know what we may be talking about. It's going to be a pressure, but where is it that that pressure occurs? Inside the cranial, which is going to be skull. L in this case, yes, okay, still is just going to be, it's okay, pertaining to. Because the word for cranium, or the actual word for the physical skull is going to be cranium. Okay, but we actually have something that we call an intracranial pressure. Where if you look at it, intracranial pressure, pressure inside the skull. Okay, that's what rises when people, yes, okay, go into coma and things like that. Or yes, okay, as a result of concussion. That's why it's okay, people after a concussion may feel or experience headache. Did that make sense? Okay. So intra is, what does the suffix or prefix or intra mean?
Inside.
Inside. Okay. And inter is
In
In
between.
between. Okay. Right. So guys, that's okay. At the first, that's okay. They may look alike, but there's a hell of a difference of being in between or being inside. Clear? Any questions? Now, what endocardium and things like that is, okay, as I know, but if you just look at it. And Justine, don't ask, okay, but that's okay, from the word. Endo. within. Which cross is okay, B is okay inside. Card. And here's okay, IME is okay, B are combined vowel. If you want, and this becomes this whole thing is becomes it's okay, the name of the structure. Okay. So why do we call it endocardium? Mainly it's okay because if you look at the heart, it's mainly it's okay going to be the structure which is going to be found on the inside of the heart. We'll talk more about this fellow as okay, or the endocardium, when we talk about the heart in our circulatory system. Did you guys get that? Okay. So end or endo, that's okay, in whatever form. Okay. Either within or inside or in between. Okay. The opposite of being in. What's the opposite of in?
Out.
Out. And what will be the word for out?
X.
X. X, right? Okay. So, guy, that's okay. We had something that we call exocrine. We have a word that's okay. Crine again, it's okay. What does that mean? Secretion. Okay. And usually it's okay. When we talk secretion, it's okay. We will know that, okay, yes, it will be glands. So that actually is okay. Glands, which is okay, broadly can be referred to as being exocrine, which will mainly mean outside. Okay. Now, please, guys, okay, those that doesn't mean that these are glands which are outside your body. But mainly, it's okay. What we can say is okay, the exocrine glands are going to be just the opposite of endocrine glands. And what was it that your endocrine glands did? They secreted their secretion into the blood. Clear? Okay. Okay, so mainly because of yes, okay, that the secretions was secreted into the blood. That's why we call them endocrine glands. So exocrine glands, what is that going to be? Is that they're going to be glands, but these will secrete their secretions anywhere else but blood. An example, sweat glands. Okay, now when you look at sweat glands, well, okay, yes, they're glands mainly because they secrete something, right? You call that substance sweat. But that sweat is not secreted into your blood, but rather onto the surface of your skin, right? So mainly because that they secrete their secretions anywhere else but blood. Practically, yes, okay. Sweat glands comes under the category of me, it's okay, an exocrine gland. You can't go wrong with that one. Did you guys get that? Okay. Now, can anybody think of any other gland that may be an exocrine gland?
Ears.
Huh?
Ears.
Ears? Okay, so what does the ears secrete?
Tears.
Tears. Oh, okay, okay. Sorry, my dear.
It's okay.
I missed the T.
It's
Tear
okay.
glands, exactly.
Tears, yes.
Tears glands, okay, good. Please don't activate those when you see your tests, okay? That doesn't help. Even if you think that you did bad, don't activate your tear glands. Okay, I can't put tick marks against just okay those teardrops that fall on the paper. Okay, guys. And say okay, well, okay, I just give okay 7 extra points because of 7 teardrops. And, okay. So tear glands, exactly right. Okay. So there's going to be okay glands, which we call tear glands. That's going to be the, what do you want to call it? Yes, okay. Basic English word for it. Okay. But yes, okay, when you look at tears, well, okay, they don't go into your blood. They're done around like this. Okay. Okay. Now, does anybody know the technical word for tear glands? It's going to be gland. Now, don't Google it. If somebody knows already, it's okay. They're more than welcome to. Nope. They are called the lacrimal glands. So lacrima is tear. Lacrimal, because becomes okay, as this becomes pertaining to, right? Okay. Okay. Pertaining to what? Pertaining to tears. So lacrimal gland is the word for tear glands. Okay. Specifically. But you can't go wrong with saying, well, okay, yes, it's an exocrine gland. It doesn't secrete the secretions into the blood. Okay. You can also say it's okay, different glands in your stomach that secretes, so yes, acids, gastric juices, stomach juices, digestive juices, etc., etc. They are all exocrine glands. Okay. Did you guys get that? So the main difference is mainly as okay, secretion into blood, secretion anywhere outside the blood. Makes a gland become endocrine versus exocrine. Did you guys get that? Okay. And then there's going to be mainly as okay, we just mentioned one of them, but there's going to be one gland which is both. It's a two-in-one. It's both exocrine and endocrine. But not now, when time is in. Okay. Okay. Now my two favorites, guys. Hypo and hyper. Okay. Hypo and hyper. Let's just take them here. Now, guys, when we say hyper, that's just going to be as okay about, or usually it's okay, we will use it, mean it's okay for things which can be measured. So we can also say okay, more than normal. Yeah, okay. Then on the other hand, you say hypo. Now hypo is okay, can just mean it's okay either below. Or it's okay, maybe it's okay because we may use it for things that can be measured. It's okay, we can say it's okay, less than normal. Is that clear? Okay. Did you guys get that? Now, please keep in mind, guys, that, okay, yes, if something is more than normal, it's going to be referred to be as hyper, this and that. But it's okay. If something can be as okay, get above the normal, it can also get okay below the normal or be less than the normal. So that's just going to be referred to as hyper. Clear? Okay. And what is it we will have in between? What's going to be in between?
Enter.
Okay. Normal. Normal levels or readings or so and so. Yeah. Now let's just take an example. Now we may have okay something that we call hyper, which we just says okay, it will be as okay. More than normal. Tension. Now, if you look at the word tension, it's okay, pretty much okay, sounds like pressure. So what the word hypertension mainly is okay or is okay. The term what I mean is greater than normal pressure. Okay, but all that's okay. Nowadays, that's okay. When we talk hypertension, we mean it's okay, just say it's okay, greater than normal. And here's okay, this pressure mean is going to be as okay, your blood pressure. Okay, so what you may as okay call as a high blood pressure, the technical term for that is hypertension. Okay. Okay. Whereas on the other hand, it's okay if your blood pressure is lower than the normal, then that is going to be as okay what you call hypertension. Okay. But what we mean is okay, is when I have in between is going to be as okay because it's okay a normal blood pressure. Did you guys get that? Okay. But it's a second. But theory is okay. Directly what the word tension just means is pressure. Okay, and that's why you may say, okay, tension headaches. Why may you get why is it that somebody may have tension headaches? Mainly because it feels like a pressure. Okay. Or you feel pressured. When a chest is coming up, what is it that you may experience? Tension. So that tension may also lead to yes, okay, anxiety and things like that. Don't get that. Take it easy. Okay? Yes.
I was gonna say, I feel like a good way to remember it is if like because a hyper person, like if you're really hyper, your energy is above, not below.
Mm. Okay. And that's why we use the word as okay, hyper, right? Okay. The actual word is not to be hyper. We just like to short things down. The word actual term is hyperactive. Okay. That's why you have your okay, ADHD. Do you guys know what ADHD is?
Yes, I have it myself.
Me too.
Why you look like that?
Okay. I just got poked. ADHD, right? Okay. Attention deficit hyperactive disorder. I hope you're able to just cope with the first part.
What do you mean?
Do you know what attention means?
Well, yeah, I have it. So I find it hard to focus all of the time.
Exactly. And deficiency or deficit means means being low on it, right? Okay.
Mhm.
So try to pay as much attention as possible.
Understood.
Have you tried those? I don't know what they were in a couple of years. Oh, I can still buy them. Those poppy things.
Pills?
Huh?
Wait, poppy things? What do you mean? Like pills?
Okay, it's a thing that you mean. It's okay.
Sensory
That
toys.
Pop
that's
it.
what.
Sensory fidget toys.
Oh, the sensory fidgets. Oh, okay.
Oh, yes, okay. They
I
even
did,
said that
but that
those
doesn't
what do
really
you
help.
call it? Spinning wheels. What do they call them?
Fidget.
There we go.
Fidget spinners.
Yeah, exactly. Those help. Okay, anyways. Okay. Good. Now let's just look at some other words. So please keep in mind, guys, although it's okay, I may just mention only the hyper, not the hypo. That doesn't mean that you can only have the hyper and not have the hypo. Okay. But we can just let's see it's okay. Hyper. Let me just start off with the easy ones first. Oops. Click. Now here's okay. The ear just indicate that this becomes a condition. Of blood with a greater than normal of glyc, which actually is it's spelled GLYC. But we actually it becomes what we'll call glucose. Okay, so the technical word for I we can actually say blood sugar is going to be hyperglycemia. So if somebody's blood sugar is measured and it's found to be high, that will be called hyperglycemia. Yeah, on the other hand, it's okay if you measure the blood pressure, not blood pressure, the blood glucose, and it's low, it's just going to be hypoglycemia. Did you guys get that? We can take another one, guys. And just so you guys say, okay, I don't keep a hypo for the discussion because it's okay, hypo. We may still go with M. And we can say it's okay. It's going to be as okay condition, yes, okay, which involves it's okay. Or blood. Well, okay, when we say hypo is going to be low. If we said hyper is going to be high, but here's okay, we went with hypo. And what I'm going to put in here is going to be natter, N-A-T-R. Vitamins is okay. Low, whatever it is. In blood. Now, what is this? Now, guys, natter actually is okay, come from the word natrium. Okay. Now, natrium, ladies and the gentlemen, is mainly as okay, just the chemical name from what we commonly know as sodium. So it's okay. In plain English, it's okay. They will call it sodium, but its chemical name is natrium. So low levels of sodium or chemistry-wise, that's okay, natrium in the blood is going to be called hypernatremia. High levels of sodium in blood, hypernatremia. Did you guys get that? So natrium is the chemical name for sodium. Did you guys get that? How many of you have had any chemistry at all? Okay, more hands than I had expected. So, okay, good. Okay, let's see if somebody is able to guess this next one. And we can just go hyper, that's fine. Hyper. We may still say it's okay. M. Yeah, which has become its okay condition. Of okay, it's blood. Now, what is this going to be?
Calcium?
Exactly, I knew that was coming.
No?
And that's not what it is.
Cows. Oh,
No, that's fine. It's too late.
okay.
You
I was
only
gonna say,
got shot. You only got one
potassium.
shot in the right. You only got one shot, my dear.
Oh, okay. All right.
That's fine. It's okay. I intentionally asked this one because I knew that was going to come. Because cal here, my dear, is okay, it's not from calcium. It's okay from the chemical name Kalium. And some of you are going to say, what the blue is Kalium? Now, guys, that means it's okay, what we just know as potassium. So what in English actually is called potassium, its chemical name is Kalium, and it's from Kalium that they put Cal. Did you guys get that? Okay, so not calcium. If you want to say calcium, well, that's going to be hyper. It's okay, greater than. If you go hypo, that's just going to be lower. Is going to be cals. is going to be as okay, calcium. And then we just put emia. So hypercalcemia or hypocalcemia. Did you guys get that? Okay. So with a KAL, that's not calcium. That is from kalium, which is the chemical name for potassium. Okay. So if you talk calcium is going to be as okay, calcemia. Okay. But here is okay, we're just talking about is okay, the levels of these substances here in the blood. That's why I ended with emia. Any questions, guys? Okay, now two hypos. Usually it's okay, we mainly mention them as okay when they become hypos. Now you can say it's okay. The outcome of both of them as okay will be the same. But then it's come as okay, what does it mean? So one is going to be as okay. Okay, yes. Okay. And we'll see ox. Yeah. Whereas on the other hand, we can say it's okay. Now some of you say it's okay, my why in the did you write this O here is okay inside the bracket? Mainly because okay, this and this here is okay, prime is okay was hypo. Okay, but what I mean is okay, just took it out, this O out of the word, otherwise it would have become hypoxia and hypoxemia. Because O and O actually is okay, ends up becoming, it's going to be pronounced like a U. Yeah, okay, so just so it doesn't become hypoxia and hypoxemia, that's okay. Okay, whereas okay, there were ox here. Now here's okay, this ox doesn't mean a male cow or a bull. Okay. Okay, guys. This means okay, it's coming from oxygen. And what the word E, I just indicate that, okay, this whole word here is the name of a condition or state. So generally speaking, SOK being low on oxygen. Is going to be SOK what we will call hypoxia. But here, okay, yes, it becomes blood. And of course, okay, the E is okay, still a condition. So condition is okay where you can say it's okay that you have a
I'm sorry, that's
N.
that's an ON.
No, it's OX.
Oh,
Okay, it's OX. So low oxygen in the blood is going to be, it's okay, what you will call hypoxemia. Okay. Any questions, guys? Any questions between these two? Have you ever wondered, yes, okay, why they put that little thingy on your finger? To measure the oxygen level. Just to say, okay, it will try to make sure that, okay, you ain't hypoxemic. Did that make sense? Good. You guys. That was just a word. Okay. Okay, let's just take another one. Let's just go back here. That's fine. And usually that's okay, guy. It becomes a problem when it's hypo. So we can say hypo. We just says okay, lower than normal. We can say it's okay. Or M, which becomes blood. Yeah, just becomes just okay. Condition. Hypovolemia. Where the word vol here mainly as okay. It's a short from the word volume. Yeah, okay. So what will hypovolemia mean? Low volume of blood. Okay, so in a state where it's okay, your blood volume is low. Now, does anybody know or have anybody any clue why they use the word volume here? To measure the amount of blood. Let us put it that way. Now, guys, do you guys ride cars? Bikes? Motorbikes? How do you guys intend to come to the school when we have a test?
The car.
Huh?
The car.
You take a car. Good. That car is going to need something to run, right?
Yes.
Good. What do you call that?
Gas.
Okay, here we call it gas. Okay, yes. Right. It's actually oil or petroleum. But anyways, peace be with that. Okay. So how do they measure it? By gallons or pints or liters, right? Why? It's a liquid. So what is the nature of your blood? It is liquid. So that's why it says, okay, if you talk about it, okay, how much blood do you have in your body? That will be referred to as a blood volume. Because they're going to say, okay, you have approximately 1.5 gallon of blood. That's the normal blood volume of an adult human being. Okay, but that blood volume is okay, decreases either because okay, you lost a lot of blood, God forbid, it's okay, in a bleeding, or it's okay, diarrhea and things like that. Okay, yes, you lose a lot of fluid. That fluid is going to be, it's okay, taken from your blood. You become hypovolemic. Did that make sense? Okay. So that's okay. Hypovolemic, that's what you become. But why? Because you have hypovolemia. Okay, low volume of blood. These guys, whenever you measure a solid, not sorry, a liquid like milk, water, juice, cold drink, gasoline, always okay. They call it gasoline, which is okay, a gas. Always okay, it's not a gas. It's still a liquid. Okay, those are going to be measured in a volume. Okay, units here is things like okay, gallon, pints, ounces, and so on. And so for gas, propane gas or propane tank, right? Those propane tanks, that's okay, holds a certain amount of gas. So even gases, yes, okay, are going to be measured in terms of the volume. How much is it? Did you guys get that? Okay. Usually it's okay when we say hypovolemia, yes, okay, well, it's in the word itself. It's going to be, okay, a low blood volume. Did you guys get that?
Mm-hmm.
Or may it blood emia. Booty, booty, booty. Any questions? So yes, okay, guys, when I mentioned hypo, doesn't mean that you can't have hyper. Or just mean it's okay when I mentioned hyper doesn't mean that you can't have hypo. You can have both, but usually it's going to be as okay, unlikely to be hypervolemic. Unless okay, you have bloated yourself up with fluids. Okay. Let's just see last one. Any question, guys? Yes, shush. Any questions? Nope. Barry. Okay, the word parry is going to yes, okay, mean this mean surround or surrounding. Now, just if you look at it, you may have come across a word peripheral. You may have heard of it as okay, that's peripheral vision. Have anybody ever heard of peripheral vision? Good. What's the peripheral vision?
It's like, I could describe it, but I don't know like how to say the meaning. Like it's like if you like could see, okay, so if I could like see my hand right here, like that's in my peripheral vision.
Although it's okay, you're looking straight, right?
Yeah.
But of course, that's okay. If you turn your eyes this way, that doesn't become your peripheral vision. Okay, so the whole thing is that okay, as when you look straight and okay, whatever you may be able to see on the sides, it's because of your peripheral vision. Right. But where did the word peripheral come from? From Perry. And maybe you say, okay, yes, okay. I still be able to see is okay, what is in my surroundings because of peripheral. Okay. Otherwise, it's okay, guys. You can just say it's okay. That way we it's okay a word, for instance, like Perry, which is going to be as okay what we'll call surrounding. Body, part, and you can say it's okay, and guys, when we see that means okay, mean that this whole thing is okay becomes the name of the structure. So pericardium. Now, why do they call it a pericardium? Mainly it's okay because it was a structure. It was mainly it's okay something that they saw that was surrounding the heart. Okay, so the verb for surrounding was peri. Okay, and what it was surrounding was in this case is okay the heart. So that structure was over there, and calling it okay the pericardium. Yeah, okay. We can check another one. Although not really a structure, but it's okay. We can say it's okay. We can still go and say peri, which is going to be it's okay the surrounding. Hepatic. Here's okay, the just or the chickpea is okay, it becomes into, and here's okay, you can see liver. Okay, so it's okay. If, for instance, says okay, we held the liver. Okay, maybe that's okay, the area that surrounds the liver can be referred to as perihepatic. Now, not really a specific term, it's very weak. Okay. But one thing that, okay, is, I remember that, okay, one of our patients that we had after a surgery, okay, got jaundiced. And the first thing that our professor said was, check him or her for is okay, perihepatic, something like whatever. Yeah, so what else can we say? Peri. Now, I would not like to go into name of structure. We can say peri. If we say it's okay, peri is surrounding. I may just use the word here. And AR is going to be as okay, continue to. Now, the person who is able to say it's okay what occul would be. OCCUL. Will also be entitled to determine how long a break we're going to have. Don't Google search it. Occul. OCCUL. Eyes. Periocular. So anything is okay surrounding your eyes will be periocular. Okay, guys. You guys up for lunch? If you can. If you can't, then. So I guess I see you guys back at 12:45. Is that a fair deal?
Yeah.
Goody moody buddy. Then have fun till then. Good. Then we can say re. Now, although your book says back, I will also say that re can mean again. Okay. Oh, that's just okay. Okay, there's a term that we say resection. Now, guys, the word section, also sect, mainly is okay, means the same as cutting. Okay. Now, if we look at it, it's going to be as okay. Cutting back. But please keep in mind, guys, the term resection is going to be the same as ectomy, which means just okay, which says okay, meaning what you mean removal of, or out and cutting. Okay, so whenever you see the word resection, it means okay, it's going to mean the same as ectomy. Yeah, okay. The difference is that's going to be that okay, as you can say, it's okay. When you use ectomy, the structure that is going to be removed will be mentioned here as a root word. Whereas if you use the word resection or removal, it's going to be as okay, you will actually say that it's going to be removal or resection of, and then you go with the structure. Did you guys get that? Okay, guys? Did you guys get that?
Yes.
Or resection just literally means the same as ectomy or removal of, okay? Other term, retro. Which means okay, it's going to be a term that will mean behind. Okay. Now in the next chapter, it's okay, we'll come across as okay another word that also mean behind, which is going to be post. Where post actually as okay means after. But also as okay can be used as a positional term and become behind. Just think of it, if somebody comes after me, that's because he or she is behind me. Yeah, okay. Or even if you talk in terms of time, post, something that comes afterwards. Okay. Post-traumatic stress disorder. Now, why do they call it post-traumatic? Because it comes after a traumatic incidents. Clear? Okay. Okay. Postpartum depression. Right. Okay. Depression that comes after partum. What is a partum? Birth. Okay. You may even go and say it's okay, post-mortem. Oops. Now, is post going to be as okay? after. Where's mortem? Death. Or you can say the word mort or mean death. This thing of being immortal. Okay. Did you guys get that? Now, what does it mean to be immortal?
You never die.
That you won't die. Have any of you heard of Genghis Khan? You never heard of Genghis Khan?
No.
Yes, I have.
Okay. Anybody who heard of him, do you mind telling me what you know? What have you heard about him? Yes. Yes, Jennifer, you said you heard about him and now you are quite also.
Oh, I'm the only one? Okay.
Okay.
Genghis Khan. I mean,
That's okay. You can always say, I just had a brain fart. It's a evaporated.
it's on the tip of my tongue.
Okay.
Yeah. I'm not sure. I don't know how to describe who he is. I just know, I guess, from movies and video games.
Okay. Okay, so what they say is that okay, he was extremely cruel, right? Okay, so it's okay, probably killed a lot of people. But probably one of the things that may not have been documented for real was that okay, yes, he wanted his, what you want to call them, doctors or as okay, physicians or whatever they had back then, to come up with a recipe or something that will make him immortal. He said, okay, I don't want to die, so I'm going to be living forever and ever. Now, of course, that's okay, promised, okay, the person who was able to bring a remedy for that, yes, okay, was promised, okay, as you can call, name the treasures. But it's okay, if he wasn't convinced, then that person will get killed. But he was pretty much okay as a Mongol leader.
The movie is called The Rise of Genghis Khan. It came out in
Yeah.
2007.
Okay.
There's a whole movie about him.
Yeah. Well, a lot of movies are just made. Well, okay. What they say is that okay, the reason that the Chinese built the Great Wall of China, was mainly to block the invasions of the Mongols. You heard of the Great Wall of China? Okay. That was pretty much okay. Why? And there's a story about that. But anyways, okay. But yes, okay. His real name was not Genghis Khan. That was just the name that he was given. Okay. So his real name was not Genghis Khan. But it's okay. One of his things was that he wanted to be immortal. That didn't work. He is long dead. And as a matter of fact, it's okay. They don't even know where he is buried. So, anyways. Okay, so, but here is okay. Post-mortem. Now, when is that going to be? That's going to be okay after that. Or that, okay, CSI unit and all that, okay? Autopsies, for instance. An autopsy. Oopsie. No. Okay, that means okay what they do as okay obtained during a post-mortem. That's okay. We can say it means it's okay. Examination. Okay. Now, if you use the word behind for retro, you can say retro gastric. Okay, yes, okay, gastric is, ick is pertaining to gaster, the stomach. So if you say that, okay, yes, if this here is okay, what's the stomach, just so we know what we are talking about. This is the front, and this is the back. You mean it's okay, say that. All this area is okay, will be retrogastric, behind the stomach. Okay. A term that, okay, as you may hear tomorrow is okay, when we start talking about the body and so on, so is going to be retro, which of course is okay will mean behind. Peritoneal, whereas okay, or EL is pertaining to. And that's going to be as okay a structure that we will call the peritoneum. Okay. But what pretty much okay as all falls, because it's okay. Behind the peritoneum. Will be considered to be retroperitoneal. Did you guys get that? Okay. So usually that's okay, the word retro, I mean, yes, okay, will mean behind. Okay, another term or after. Or what also is okay. Word be as okay, a word for behind is going to be post. Which means it's okay, it comes from the word as okay. Literally means it's okay after. But as a positional term, it can also be used okay for behind. Or next term, sub. Now sub is just going to mean under, or you can even say it's okay below. Okay. Now another word that also says okay may mean the same as under and below is going to be infra. Or you can even say it's okay infer. They will also mean under and below. But there are going to be some instances where we use the word sub rather than infra or infra. For instance, when you go, sub cutaneous. Yes, this is just going to be pertaining to. Cutaneous, guys, is just another word for skin. Okay. If you say this is skin, and what lies underneath the skin is going to be subcutaneous.
Is that Autane?
No, it's Cute. So
Okay, thanks.
cutane, Cutane is just another word that also means skin. If that makes sense to you. Okay. So usually, guys, for instance, if a substance or a drug is injected underneath the skin, that will be what we can call as a subcutaneous injection. Okay. Now, example of subcutaneous injections would be something like insulin. Okay. I mean, yes, because the patient is have to poke himself or herself 2 to 3 times a day with insulin to get insulin shots. That's why it's a lot of people may not be sticking to their diabetes treatment. Right, okay. It's not fun. Right? So that becomes subcutaneous. We can take another one. And we can say sub, which we can say will be below or under. It's going to end with L, where L just becomes pertaining to, but pertaining to what your root word is, which will be, the root word was lingua. Now, does anybody know what the word lingua means?
Tongue?
Huh?
Tongue?
Tongue. So underneath the tongue or below the tongue. Okay, that would be sublingual. Now, guys, if you look at the word lingua, which we see as means tongue. And you look at the word language. Don't you see some similarity? Now, I can ask this question here in a couple of ways. I may say, yes, okay, what is your primary language? Now, usually people will say, okay, think of their primary language as the language that they are best able to express themselves. Right? Okay. But then if I ask you, yes, okay, what is your mother's tongue? Have anybody ever heard of mother's tongue?
Like native
Yeah.
language?
It's your primary language, right? Okay. And you may say, well, okay, my mother's tongue is in my mother's mouth. What does that have to do with me? But they may also call us, okay. So why would they also link the tongue or lingua, like the language?
Because you speak with your mouth.
Okay, so what's the word for mouth?
You speak with your tongue.
Okay. Okay, yeah, we use the tongue, right? Okay. Okay. So yes, okay. Here, that's how words come into being. Okay, so yes, okay, your mother language is your mother's tongue. Now let me just put a crazier scenario. If somebody's mother is Chinese and father is Italian, what is going to be your mother tongue? Your mom is Chinese and your father is Italian.
Wouldn't it
What's
be Chinese?
No.
Would it be like the first language that was taught to you?
Both.
It goes after father. So ethnically, racially, you say, okay, well, what in the hell am I? Am I Chinese or am I Italian? You be Italian. You may not speak a single word of Italian, that's fine. That's how it goes. So, anybody who has a crazy mixture like this, mother
Dominican,
Chinese.
Jamaican?
Huh?
Dominican and Jamaican?
Okay, that's not that crazy.
All right.
It may look crazy on the Jamaican side or the Dominican side, but for our side, no. Yeah. But anyways, so why would they call it a mother tongue if it doesn't go after mother? Who would take care of the child for the first couple of years? Most of the time,
Your mother.
the mother. So you can say, okay, it's okay. The primary word that you end up learning, it comes from
Your mom.
mom. That's only why. Okay, guys. So that was that. So yes, okay. Now my first language to learn was Danish. So up to yes, okay, the age of 12, that was the only language that I could communicate in. Now is that my mother's tongue? No. call my father's language is something else. So that becomes my mother tongue, although it's my father's language. Although I didn't speak in it until I was 12. I started learning it at 12. Before that, I could just say Assalamu alaikum. I could say yes. I could say water. And I could say no. It's not around. I don't have it. Like somebody asks you, do you have a penny or a phone or something like that? I'll say no, I don't have it. So that was pretty much okay. All. If somebody asked me, how are you doing? I didn't understand a word that they were saying. Forget about replying. If you don't understand, well, okay, then you can't reply. Or if you learn a new language, it's going to be easy to understand what is being said. Or if somebody asks you, can you say the same thing? Oh, hell no. So that's okay. Whatever English I'm speaking, this is all something that I learned after the age of 12. All the Urdu I may be speaking is all I learned after the age of 12. All Pashto that I'm speaking is all after what I learned after the age of 12. And maybe it's okay a little bit phrases in Arabic or words and so on. So, but if you say a whole sentence in Arabic, I may be able to figure out what is being said just because, okay, I know a word here, I know a word here, and so on. So, but if somebody say, okay, can you say the same thing? No, I may not be able to do it. Okay, so that's okay. You can be bilingual because you're able to speak two languages. That doesn't mean that you have two tongues. Okay, being bilingual doesn't mean that you have two tongues. Who has two tongues? Or what has two tongues? No clue? Have you guys ever seen the tongue of a snake? Isn't it split? So does he or she speak two languages? Probably not. Okay, guys, please be with that. Okay, but that's okay. You say that okay, sublingual is not going to be as okay under the language or the hidden message in the language. It's going to be as okay as sub underneath the tongue. But it's okay from the word comes, or from the word lingua comes the word language. Good. We can also say sub singa dural. Now don't get carried out what okay yes it's going to be. But yes, okay, al is okay, just yes, okay, you're pertaining to. And the word dur here is not dur, but actually is okay, come from the word, sorry, dura. Now what that dura is going to be is okay, we will talk more about that tomorrow. Okay, but that's going to be as okay. Now, just to give an example, okay, when we use the word subdural, that's going to be something that we call a subdural hematoma, which mainly will mean that, okay, yes, that if this was the dura, what we're going to have, okay, having the area under the dura is that there will be a hematoma. Yeah, okay. Why they call it a subdural hematoma? Because it develops underneath the dura.
Did you say that dura means clot?
No,
Oh,
the dura is not going to be a clot. Dura is, don't worry about that, my dear.
okay.
Okay, we'll talk more about that tomorrow. Okay? Okay, but when we say it's okay, so dura, but when we say subdural, it's going to be okay underneath the dura. And what may happen is okay in the subdural area, a hematoma. What was a hematoma? A collection of blood. Did that make sense? How did it get there? Usually it's okay as a result of a concussion. How do somebody get a concussion? Yes, okay, bang the head into a wall. Yes, okay, that will give you a concussion. Yep.
Didn't you say a hematoma can mean just a bruise too?
Yes, but that's if it's going to be visible.
Okay.
A bruise is when it's visible. So that collection of blood underneath the skin that you see in the form of a black eye or a bruise. What can you have is okay, hematomas which are not visible, of course. Why they're not visible? Because okay, they are or they developed in areas okay that is not going to be visible to the naked eye. Okay. So you can have okay as an intracranial hematoma bleeding inside the skull, right? Would you be able to see that? No. Okay. Okay. You can have okay as a retro or ocular hematoma. Now retro is behind ocular eye hematoma, bleeding behind the eye. Okay, or your eyeball, if that's what you want to call it. Would you be able to see it by your naked eye? Yes, okay, if you look at a person? Of course not. Okay, okay. You can have okay as an intra-abdominal hematoma. Okay, now what's going to be the difference between a hematoma and a hemorrhage? In both cases, okay, your blood vessels bleed. But in a hematoma, it collects as a mass. That's where it was hemorrhage was blood, oma became a mass. So it collects as a form of a mass. You have a collection of blood, right? Right. There you go, hemorrhage. Hemo was blood. Rage was discharge. So discharge of blood. But this whole word here actually is okay, just a fancy word for what you call bleeding. But when is it that you usually would say that, okay, as a person is bleeding or he or she is having a hemorrhage, if you see the blood running, right? Did that make sense? And when will you see the blood running? If it leaves the body. Okay. And that's why I say it's okay, that black eye. It's only it's okay if there's a rip in the skin that black eye also is okay, may bleed. Just watch boxers. Okay, to begin with, okay, they may have okay as a black eye. But the opponent is okay, keeps on, is okay, punching him or her usually, I'm sorry, on that black eye, at some point, okay, the skin may rupture. And what's going to happen next? You start to bleed from that. So the black eye itself is okay, just a hematoma. Now, if it's bleeding, it's hemorrhaging. Did that make sense? So hemorrhage is where there is, okay, is that the blood from the ruptured blood vessels, okay, leaves the body. Otherwise, it will be a hematoma. Any questions? Woody. France. Now, guys, what the word France would mean is through, or across. Okay. But yes, okay, if you are Caspers, the friendly ghosts, and were able to, yes, okay, pass through walls, that were actually, yes, okay, enable us to, yes, okay, go across walls, right? Yeah. Now, the first sound that you may see is, or yes, okay, in your book is trans, pshimupshi, term, L, pertaining to, term is skin. Or when we say, okay, transdermal becomes, just okay, pertaining to through the skin. Okay. Now, when we talk, yes, okay, transdermal, usually is okay when we talk about things such as patches. Or we can say, okay, patches of medicine. Because some medications may be given, yes, okay, you can say, okay, transdermally. Why? Because you have a patch. Okay. Now that patch, guys, is going to just, okay, be placed on the skin. Okay, but how is it that you're going to benefit from that? Mainly because that medication goes from the patch through the skin. And as it goes through the skin, it's okay, that's how, yes, okay, it, you can say, it's okay, enters your body. Okay, so this kind of, okay, yes, you can say, it's okay, route of administration, as we call it, is transdermal. Anybody has tried to get off smokies? cigarettes. So why do you never started smoking? Or if you started smoking, you never tried to stop. Well, you have those nicotine patches, right? Okay. What is it then smoking that causes people to just go once they run low? That's nicotine. Okay, so they say I'm right now about get 6 packs a day. It's too much. Too much smoke. They may get some of that nicotine by a patch. But they apply it and I mean, yes, okay, that nicotine is going to release nicotine through the skin. So some of the nicotine requirements, yes, okay, may be fulfilled from that. Okay, but idea is okay, should be yes, okay to take you or reduce your tobacco consumption or smoking as okay, cigarette or prime is okay to take you off it. So you don't have to smoke like a chimney. That makes sense? But that way in which you get your is okay, the substance, in this case, nicotine is transdermal. Are those pain patches that they put, Diroderm and things like that. Right? A big patch that they place, and okay, it's me, yes, okay, that's going to administer, you're going to get the drug, give, yes, okay, supply to you through the skin. So that would be transdermally. But guys, if you just look at the word trans, now have some of you ever seen this word before? Or trans would be across or through. So where in the hell is a port?
Is it a path?
Okay, you are
Yeah. A vessel? Port? But yeah, to travel through, isn't it? Just it's like a path.
now in day to day, yes, okay, you may use the word transport, right? Okay,
Yeah.
which means it's okay going from point A to point B, right? But why would they use the word transport?
In medical terminology?
No, 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 no. This is a regular day to day English word.
Oh.
You're going through
The
different.
port actually is okay, would be an opening.
Opening. That's the word, not vessel. Yeah.
Okay. Now I don't know how much of medieval time history you guys have been doing. Well, it's okay. If they build a wall again, it's okay. Like China or the Great Wall of China, right? Okay. Why did they do so? Why did they do so? According to the story, it's okay to keep the Mongols out, right? Now, neither were the Chinese, neither were the Mongols Caspers. So how would you get through the wall? you will make an opening, right? Or no? If I say it's okay, go to the room next door, how would you get to that room? You probably it's okay, walk through the door, right? Okay. So that's okay. Big doors or gateways, as you may call it, in cities, because cities were mainly as okay encircled in walls. They made us okay big gateways, and those gateways were called port. So the word transport made as okay means you go through the port. Now we just use it okay as transportation is okay going from point A to point B. Okay, nowadays no towns or cities may have walls around them. Of course, they're too big now. But just go and just okay a book that talks about timeline, and you may see that okay, yes, before in the days, that's okay, towns or cities or whatever you want to call them, villages were being encircled in a wall. Have any of you have seen the movie Troy or heard of the Trojan horse?
Yeah.
And what was it that the city of Troy was? It was encircled in a wall, right? So
Mhm.
those invaders were not able to invade it because, well, okay, they were well protected behind those walls. And that's why they made the horse, this big wooden horse that was pulled in. And okay, once it was inside the wall, then the soldiers jumped out. That's the Trojan horse. Okay, guys. Now you may see as okay a couple of words that's going to be as okay where we use the word France. We can say it's okay, one is going to be trans, but then we use the word plant. Now what the word trans is okay mainly is okay for me it's okay across or through, or more practically it's okay from another source. Or have any of you ever heard of the word transplant? Let's do it that way. Or can somebody give me an example or a couple of examples of transplant?
So if you have like a heart transplant, you're like taking someone, no.
Okay, go
Oh.
ahead.
You're like taking out the doctor's like removing your heart or replacing it with someone else's heart. Is that wrong?
Okay, no, but when you say a heart transplant, that's because you get a heart from somebody else
Right, like a donor.
planted. So it's going to be the donor's heart that is going to be planted inside you.
Yeah.
You go skin transplant. Okay. Now usually it's okay when we take skin transplant, that's going to be it's okay, your own skin. Okay, but the reason that they call it a skin transplant is because it's a skin specimen taken from another area and just brought across up to the area where the transplant is placed. What else can be transplanted?
Hair follicles.
Oh.
Hair.
Hair transplant, right? Okay, good. What else?
Kidney,
Kidney, good.
Lung,
Okay. Liver. Right, okay. But where does those specimens come from that are being transplanted?
from another person, another
Another
human.
person. And maybe because it comes from another source or is passed across or through from person to person.
Mhm.
That's why they use the word trans. Okay. But why would they use the word plant?
Because you're planting it.
What are you planting?
The organ.
Okay.
You're putting it in like a plant.
Or just like planting a seed, right?
Yes.
But the reason that we call it, or the reason that we use the word plant here is because for me, yes, okay, is okay, broad from either another area, if you talk of skin transplant, or whether you talk about kidney, liver, as okay, even heart. That this structure here is okay. It's okay, it has a form or shape. Or it's more of okay as in a solid state. Okay. This would be the heart. This, for instance, okay, will be the kidney or something like that. Okay. That makes sense. So mainly because okay, it has a fixed shape or form. That's why it's okay for things that are being it's okay brought on from person to another person, or from one area of a person to another area, since it has a shape or a form, because it's in a solid state, will be called okay as a transplant of this, a transplant of that.
So because it's a solid shape.
Pretty much. Just as I said, you have a seed, right? That seed, what does that have? It has a shape, right? And what do you do with that seed? You plant it. That's how I remembered it. Clear? Because there's going to be another word where we use the suffix, also not suffix, prefix, trans. Here you go. You. Oh, okay. Or what we'll say here is going to be trans fusion. Again, is okay here, is okay, this trans has me, it's okay because it comes from another source. Or we can say it's okay living. But then what enough is all the buzz about the fusion? Mainly because here we talk about something which is liquid. Okay, so the common thing that you mean is okay, we'll get as a form of a transfusion is going to be a blood transfusion. Okay, where you go and say, well, okay, the blood that we is okay get in a form of, okay, as a blood transfusion come from a donor. But the reason that we don't use the word plant here, because the substance that we get from the donor or what we receive is in liquid form. Did you guys get that? Okay. So usually there's